Hello, it's Dr. Stephen Tugbiyele here again, your urogynecologist, and in this video, I'm going to answer the question, what is an overactive bladder? Now, if you've watched my previous video on urinary incontinence, I went into some detail about overactive bladder in that video, so you can actually definitely plan to watch that if you haven't already. And in this video, I want to go into more detail and dive deeper into this condition that affects millions and millions of women. And so when we talk about an overactive bladder, we're talking about kind of a constellation of symptoms. Urgency is one of the major symptoms, where it's a sudden urge to empty the bladder that women feel. It's not a gradually increasing urge, well, oh, I need to get there soon and I can still wait. No, this is a sudden urge that they have to make it there, or they fear they may leak. So that's urgency. And then there's frequency. And, over the years, frequency has been defined in so many different ways, but generally, if a woman is going more frequently than she would feel like it, if she's bothered by that, there are other definitions of, going more than 8 to 10 times in a 24-hour period, going more frequently than every 2 hours. I would say, generally going more frequently than a woman would consider normal is frequency. And then something called Nocturia. Some women experience Nocturia, other women don't, meaning waking up at night to empty the bladder, make it up more than once. So if her sleep is being interrupted because of the urge to go, that then impacts her ability to get back to sleep and, impacts her sleep quality. That too is, contributes to an overactive bladder. And that can be quite an issue because, that's been associated with falls and women who wake up in the middle of the night, having to make a trip to the bathroom where it's not as well lit, and that can, lead to other issues. And then some women leak urine if they don't make it there on time. We kind of call this a gotta go syndrome, where you gotta get there, and some women leak urine if they don't make it there on time, but other women don't. And so it's a condition that affects many millions of women. Affects women actually more than men, and quite bothersome. A lot of my patients over the years would say they are afraid to leave the house. They don't want to go dancing. They don't want to go to worship service. They don't want to. I had a patient tell me she didn't want to fly to see her kids because she wasn't sure she was going to be able to be secure on an airplane trip and not have to be in the bathroom several times. Or she didn't want to even get to her kid's house and have to wet their bed. So you can only imagine the impact it has. Some women don't want to go dancing or exercising or whatever the case may be because they're afraid they may leak, and they are memorizing all the bathrooms in the mall, and they're afraid to go out, or they may be afraid during maybe intimate times they may leak. So it can really affect a woman's quality of life in a significant way. It's been associated with, depression and all sorts of things, because it really impacts a woman's quality of life, having to have your life centered around the bathroom and bladder control. And, well, how does this happen? Why? Well, it's, it's definitely more associated with women who've had children and, aging. Unfortunately, is one of the risk factors as well. It affects, as I said, women more than men. In terms of just anatomy, the brain controls the spinal cord, which then controls the organs through nerves. And so oftentimes if there is any issue that affects either the brain, like a stroke, or if it affects the spinal cord, like a spinal cord injury, or surgery to the spine, or issues with the lower back, or anything that affects the nerves that impact that come from the spinal cord for the bladder. That could be pelvic surgery. Some women, it could be radiation therapy for cancer. Anything that affects either the brain, the spinal cord, or the nerves that leave the spinal cord that feed the bladder can cause an overactive bladder. And for a lot of most women, it can be just childbirth, getting older, menopause, thinning of the vaginal tissues, and those things that can cause an overactive bladder. But it is quite common. And so in terms of treatment options, we of course in the office would do an evaluation, because there's so many things that can cause an overactive bladder, or there's so many other conditions that have the same symptoms as an overactive bladder. One simple one is a bladder infection. So some women may have a bladder infection, not really know it, and treating that bladder infection can relieve her symptoms. Now, of course, there are some women who have these symptoms and don't have a bladder infection, but that's a very simple condition that we like to rule out when we evaluate patients with this condition. Or, we also like to evaluate if a patient has normal pelvic floor support. I always like to say, anatomy affects function. So if there's an abnormality in the anatomy of the pelvic floor, for example, the bladder, if that has dropped, that's going to affect function of the bladder. And so if the bladder has dropped, if there's a cystocele or prolapse, and I talked about this more in that prolapse video, then it can cause women to feel as if she hasn't emptied her bladder completely. It may cause her to have to wake up at night several times or feel urgency that she's never completely empty. So there are definitely things that need to be evaluated that can be nipped in the bud and be treated with this condition very simply. However, when we talk about, an overactive bladder, then some women would consider a natural option first, for example, like Kegel exercises, strengthening the muscles of the pelvic floor. These are the muscles that support a woman's pelvis from front to back, from pubic bone to tailbone, and hip to hip, side to side. And I'm kind of, keeping it kind of simple, but these are the muscles that women would squeeze to stop the flow of urine midstream or stop gas from coming out unwantedly. And when a woman has strong pelvic floor muscles, when she feels the urge to get to the bathroom, if she were to squeeze her muscles rapidly several times, actually there's a mechanism, bit of a reflex that would cause the urge to diminish, so that women feel like they have more control, or they can just kind of squeeze and make it to the bathroom on time as they're preparing to empty their bladder. A lot of women don't have strong enough pelvic floor muscles and may need additional help. I always say 100 Kegels a day keeps the urogynecologist away, so if a woman can do them regularly, then that'll help. Some women may need additional help, like seeing a pelvic floor physical therapist, and these are well-trained, highly valuable specialists that we refer our patients to help coach them on getting their muscles stronger. And a patient would see a therapist once a week for about an hour over the course of 2-3 months generally. And sometimes a woman may just see a therapist for one consultation visit and then do the exercises on our own. And that has been found to be very helpful. There are also just general lifestyle changes that women can implement. Drinking enough water. Some women don't drink enough water. And then some women may drink too much water, where their urines are like clear and is running right through them. And granted, the bladder and your kidneys would love it, but it's just too much volume of water. And so kind of a good middle ground is key. And generally in a normally sized patient, it may be up to 4 to 6 cups of water, no more than 8 usually in a 24-hour period. And so that can be very helpful. Things that can cause urgency: coffee, tea, soda, artificial sweeteners, alcoholic beverages, highly acidic juices. These are beverages that can be associated with women having more urgency and making more urine. And so, curtailing that and cutting back on those beverages are important, and drinking more water, and definitely reaching a nice balance there. Weight loss for women who are significantly overweight or obese, that can be helpful because there's less pressure on the pelvic floor there. So those are kind of natural lifestyle changes that women can implement to help to improve their symptoms and their bladder control. And then there are medical options that women can implement, such as medications. I always tell my patients that I have no financial incentive or stock in medicines. I kind of, that's one option that I counsel patients for, and some patients choose a medication because it helps them and they are helpful. Other women prefer not to be on another medication because they're already on too many, or they prefer not to take any medications at all, and that I support both. And so the medications are several on the market, but generally they help to either relax the bladder and keep it from being overactive, or they help to prevent the bladder contraction. So either way, it's helping to keep the bladder relaxed so that women can hold more, make it to the bathroom in a better fashion, not have to go as frequently to the restroom, essentially. And these medicines do help. Of course, with that, there are side effects that some women may experience, like dry mouth, dry eyes, constipation, dizziness, blood vision. So some women, there are side effects that women may not like. Dry mouth is another one. that limits some women from choosing a medication. And then there are surgical options, procedural options. For example, some patients have benefited from Botox, injecting Botox into the bladder to help to relax the bladder, or a nerve stimulator to help to control the nerves that leave the lower spine and control the bladder function when it's time to fill, when it's time to store, when it's time to empty. Really controlling those nerves can really be helpful. And so placing in some women who choose a nerve stimulator or a pacemaker for the bladder can be very, very helpful. There's so many options, and I know I kind of condensed a lot into a very short period of time, but long story short, tell women that they don't have to live or put up with these symptoms. It's very common. They're not alone. There are good options that are safe, effective, and that work. And getting an evaluation and seeing, for example, a board-certified urogynecologist can be very helpful, because this is what we take care of week in, week out. It's common, but it's not a normal part of aging. And we like to encourage women to really seek help to improve their quality of life. Having said that, if you would like more information about this, you can visit my website, www.Dr. Stephen Tugbiyele, Stephen with a PH, Tugbiyele.com. Or you can visit my YouTube site and or my LinkedIn page for more information and for other videos. If you know women who you feel like this will be very helpful and educate them, they need this information, please do share. This information. A lot of women live and put up with this. They're embarrassed. They don't want to talk to anyone about it. They think they're alone. So if you could share this, that'd be really helpful. I'm very passionate about educating women, seeing them live their best life, and so that would be really helpful. My practice website is www.northsidecenterforurogyn.com, and there'll be a link attached to the video for that, as well as my office number, which is 470-325-1280, 470-325-1280. Thank you, and hope this was valuable to you, and to the next video, take care, be well.